embark on today's critical discussion about the future of Canadian healthcare, I'd like to start with a quick poll to gauge our collective understanding of one of the most pressing challenges we face. So please take a moment, look at your screens to answer this question. We'll reveal the answer shortly, and I think the number might surprise many of you. So welcome to what promises to be a transformative discussion about the future of Canadian healthcare. Over the next 60 minutes, we'll explore critical challenges facing our healthcare system, and more importantly, examine emerging solutions that show real promise. Now, consider Sarah. She's a 45-year-old mother in rural Ontario, juggling dual healthcare responsibilities, managing her diabetes while being the primary caregiver for her father, who has early-stage dementia. Despite using various digital health platforms, Sarah faced a critical challenge last month when coordinating care between multiple specialists, her family doctor, endocrinologist, and her father's geriatrician. The fragmented nature of their medical records became dangerously apparent when her father was rushed to the ER and doctors couldn't access his complete medication history. Now, Sarah's story is very familiar to many Canadians. It illustrates three fundamental challenges we face in 2025. Number one, the persistent challenge of fragmented patient data, where critical information remains trapped in silos. Two, the growing crisis in healthcare access, particularly in rural and remote communities. And third, the lack of healthcare workers. So looking back to our opening poll, the correct answer is 44,000 physicians are needed by 2028. It's a number that really underscores the magnitude of our healthcare staffing challenge. Now, the statistics paint a clear picture. 1 in 5 Canadians, an estimated 6.5 million people, lack a primary care provider. Healthcare spending has reached 12.4% of GDP, $372 billion spent in 2024. 75% of doctors say their administrative workload is an impediment to caring for their patients. Now, today's discussion isn't just about challenges. We'll examine how responsible technology implementation and evolving insurance models are creating new possibilities for healthcare delivery. And importantly, we'll explore how these innovations are expanding healthcare providers' capacity, enabling team-based care models, and creating new possibilities for accessible, efficient, and patient-centered healthcare across diverse communities. To guide us through these critical discussions, I'm delighted to introduce our distinguished panel. Each of them brings a unique experience to this conversation. I'll start by welcoming Hashim Fahmy, Chief Information Officer at TELUS, leading technology innovation across TELUS's global lines of business. Welcome.
Thank you.
Dr. Sasha Bhatia, Executive Vice President of Primary Care and Community-Based Care, driving system-level change at Ontario Health. Welcome. We have Dr. Kevin Brophy, a family physician pioneering digital health transformation in primary care. Welcome. And finally, Eric Trudel, Executive Vice President and leader of group insurance at Beneva, reimagining the role of insurance in healthcare. Now, together, the four of them represent different facets of our healthcare ecosystem, each uniquely positioned to explore both the challenges and the solutions that will shape the future of Canadian healthcare. So let's begin the discussion on the exponential growth we're experiencing in the world of technology happening right before our eyes. Hashim, if I could, I'd like to start with you. You're the CIO of TELUS. You're at the forefront of technology innovation. We're witnessing this unprecedented pace of change in AI and technology adoption. Could you share your perspective on the current technology landscape, particularly with AI, and what TELUS's approach is to adopting these transformative technologies, and of course, doing this while ensuring responsible and ethical implementation?
Thank you, Andre, and thank you everyone for having me here today. I think it's a fantastic question. And really, when we think about AI has been around for several decades now. And so what's new? And what's really new is the traditional AI used to be all what we used to call predictive AI. You train a model, you have guaranteed inputs, guaranteed outputs, and you're always trying to use it to predict what the next step is. And then in 2022, GPT came along and ChatGPT, and it really kind of changed the landscape altogether. And you've got into a world of AI where it can be infinite, the possibilities. It's generative. It also has this huge body of knowledge, and it can sort of ask and answer questions in any domain. And all of a sudden, it became this very powerful tool. And then what's really, really happened and fascinating is the advancement that has done. So if you look at back 2-3 years ago, it was very primitive, and it hallucinated a lot. You couldn't really trust it. But now, just in the span of the last 6 months, what you see now is it has large, what they call context windows. So it means you can have very long conversations with it, and it can remember everything you're saying, and so you can have this really great dialogue. You can feed it a lot of information and understand. It's become having reasoning abilities. So it's no longer just spitting out information, but it actually can do logic and reasoning. And now it can connect to tools, and so now it can be agentic, is what we call. So now you can tie it into workflows and tools, and this can act on behalf of you. And so with all of that, this immense amount of power, and that just happened over the past 6 months. And so this is what's truly transformative about it. And so like what we saw over the last 3 or 4 decades pales in comparison of what we're seeing happening in the months that are evolving. And so I think that just it opens a whole world of possibilities and how we can lean into it. And I think what we realized very early on, like 3 years ago, when ChatGPT came on the scene, we kind of saw the writing on the wall. And so we said the best way to do it is how do we make this accessible to everybody? And how do we make it, the term we use internally in TELUS is how do we make this the email that everybody uses? No one struggles to use email, or no one struggles to use an Excel spreadsheet. So can we make this easily accessible? And so we created a safe, secure, GPT environment that everybody could play with. And that built the familiarity. And from there, we started growing the adaptations and use cases of it. And so when it comes to, for health, we're looking at many ways of using it for helping with the medical records and documentation and making that a lot easier and making that more potent. And maybe the last part of your question was, how do you do this responsibly? And the idea here is it has to be from the get-go. It can't be a bolt-on after the fact. And so we always early on said that we had to approach everything with a responsible framework. So we have a governing body inside TELUS, our generative AI board. We were one of the first signatories to the Voluntary Code of Conduct in Canada. We were the first to get globally the ISO Privacy by Design in terms of how we use our data. And so really the short answer is it has to be by design from the get-go. As you ideate and imagine, you have to incorporate how you're building responsibility into it and all the
And you're also making big investments in this field. TELUS just announced that it's building Canada's leading sovereignty AI factory, for example. Can you talk a little bit about that and how important that is?
Hugely important for Canada. I would say the first and most important problem we're trying to solve here is scarcity. In order to do AI and to run AI, you need the compute. You need those GPUs. And the fact of the matter is those are a very scarce resource globally right now. And there are very few large corporations that are hoarding most of that. Not for nefarious reasons, but it's just their business model. And so that's constraining people out of the market. And if we look at all these great use cases, if we want to even adopt it in healthcare in Canada, but you need to have that locally, where can you run that? Where can you run that inference? And so that's what we wanted to solve. And so we did this partnership with NVIDIA. We are the largest AI factory in Canada, one of the first North American partners for NVIDIA on this. And what this does is it guarantees Canadians access to a large pool of this AI compute. So that's the first thing. And so then we can control our destiny, as a nation, that we will never be constrained out of any AI innovation, whether it's training and building new models, or actually applying those models in very innovative ways, like in healthcare and providing better healthcare outcomes.
And you're not just an adopter anymore, you're an enabler.
We're an enabler, exactly. That's the big part of it. And then the second part that comes in is, okay, now, but it's on Canadian soil. And this is where it becomes very important, and this is the sovereign aspect to it, is there are, for very good reasons, AI doesn't work without data. And if we just take the example of healthcare, that is going to be our Canadians' healthcare, private healthcare data, that has to stay within our borders. And the speaker before us was talking about the continuum of care. I mean, you want that care to continue from your various physicians giving you the care to your medical facilities to your hospitals. That should all stay within our borders. And how can you secure that? And that's not just where it physically is located, your data center, but also all the network routes and how does it go? Like, how can you guarantee that that data can always flowed and stayed within your borders? And so that's the second element. And then the third for us is AI always has this stigma that it's going to be detrimental to the environment because it's very energy hungry, very pollutant. And this is where TELUS is very proud of, is because these two AI factories that we've created, they are 99% running on renewable energy. So the carbon footprint is negligible. They run 98% on free cooling. So all the cooling of those chips is coming from our natural climate in Canada. And so again, how do we lead by example and having this very good, sustainable implementation and accessibility of AI?
Great. Thanks a lot, Hisham. Now let's examine how some of these challenges are manifesting in our healthcare system on the ground. Dr. Brophy, Dr. Bhatia, you're both frontline care delivery people, and you have a very unique perspective on how physicians practice. So let's start, if I could, with Dr. Brophy. As both a family physician, a digital health strategist, you're seeing both the promise and the limitations of our current digital health solutions. So what fundamental assumptions are we getting wrong in how we're approaching this digital transformation?
Thanks, Andre. I really appreciate the chance to be here on this incredible panel to discuss this and give the family physician perspective. So thank you very much, everyone. I want to go back to one thing you said there. What assumptions are we getting wrong? I just want to highlight one thing where if we had more family physicians in strong leadership positions, we wouldn't be needing to make these assumptions. So I think our system really needs to start to create the capacity for the community family physicians to start to take on those leadership roles, because they know their communities, they know their patients the best, and they know what they need, and we know how the system can function best. Now, going to your point, what assumptions are we getting wrong? I'll try to simplify it into maybe two topics. First off, this idea that sometimes digital is always better. If you're just digitizing a paper process, you're just going from death by 1,000 paper cuts to death by 1,000 clicks. So we're not really moving the solution forward. So we have an opportunity here to really think and redesign our workflows from the ground up, where we can take advantage of how technology, AI, like Hisham was talking to, can integrate and put these care factors together in really meaningful ways. If we don't, we run the risk of creating opportunities for digital health harms. So going back to the example that you gave earlier around Sarah and her father, well, yes, it's important that the system's interconnected and all that information flows to the emergency. We know allergies and stuff like that to prevent bad outcomes. But what if I don't get meaningful digital information back to me and I end up getting multiple copies of the same thing, or I get every single blood test result that is done while they're in hospital and I've got 50 pages to go through and an important result gets lost in there and that doesn't get followed up with and there's a bad outcome? Well, that's something that could have been prevented with a more thoughtful approach to redesigning the system. The other assumption that I think we need to be careful of is the idea that the tool is enough, the digital tool is enough. And unfortunately, integrating some of these into meaningful clinical workflows is difficult. And the analogy I use for family physicians right now, especially in the primary care crisis all across the country and in Ontario in particular, is we're so busy putting out fires, we don't have the time to install our sprinkler systems. So we need to design our tools to include very robust change management supports that are going to help us implement these tools in meaningful ways. For example, going back to Sarah's example again that you were giving. So her and her father are discharged from the hospital. They need to follow up with their family physician. Let's say I've got an online booking system, but I haven't really figured out how to use that and implement that very well. So they figure out how to get on that portal. They try to book an appointment with me, and it's 3 months down the road. Well, what are they going to do? They're either going to wait 3 months and potentially miss out on, a better outcome because I could have caught something earlier, or they might go back to the emerge, or they might go to a walk-in clinic, which further fragments the data and puts their care at risk. So I think we really need to be mindful about these opportunities and really think from the ground up again now that we're making this transformation.
I think you made this important point at the outset that who asks the questions is going to give us different answers. So that's really important, that family doctor input. Great. Now, Dr. Bhatia, you have a senior leadership role at Ontario Health, extensive work in health system solutions. What systemic barriers do you see as most critical to address at this time?
Yeah, I think, it's critical, Andre, and thanks for the question, to understand the barriers. I categorize them in a couple of ways. You've got sort of your local system factors or structural factors. You've got factors around funding, and then you've got, I would kind of classify them as cultural factors, or, the way that our healthcare system has evolved over the years. So, starting with, say, your structural factors, people think about Canada as a single-payer healthcare system, and it is a single-payer healthcare system, but it is a multi-delivery armed healthcare system. It has multiple delivery channels. So we are a collection of hospitals, primary care clinics, long-term care homes, pharmacies, all of which have unique and individualized governance structures, and as well as barriers and what I would call like policy moats that prevent data flow from easily moving across them. So that's a very difficult challenge because each of those owns their own data and their workflows. The second, we talk about is funding factors. So we have to remember historically, healthcare in Ontario and really in most of the developed world has been funded through really piecework type funding, which is activity-based funding. So every time I see a patient, I bill a fee. Every time a hospital admits a patient, they get a bit of money. And so it's all based on not necessarily an outcome-oriented solution, but rather it's based on flow or volume-based funding solutions. And there are some examples of where that's changing, but that doesn't necessarily incent the kind of longitudinal, continuous chronic disease management that I think our system needs, because the way that our healthcare system has evolved from an acute-based treatment system to a chronic disease management system has fundamentally changed over the years. And that kind of leads me into the last point, which is really around this notion of culture. When you think about it, hospitals historically were created with this notion of like managing acute illness. So you came in with a broken leg, you came in with a heart attack or a gallbladder, you needed surgery, you needed something acute to fix. And that is still true, and I don't want to diminish the role of the hospitals in managing acute illness. But the fundamental shift in our healthcare system has been actually a great success of our acute care system. People survive their heart attacks. People that were blue babies, where they were born with a congenital heart defect, are now having children of their own. The HIV scourge of the 1990s are now patients I see in my practice in the 2020s who are now coming with heart disease because they've lived long because the drugs are treating them. And so there is a fundamental shift in the way that we need to think about prevention, the role that primary care has to play in the continuum of a person's lifespan, and then thinking about how teams begin to work together around with the patient at the center to sort of keep them as well as possible. This is a fundamental shift that requires our tools, to Dr. Brophy's point, to fundamentally evolve to sort of manage in a new disease or health paradigm. And this is where I think, digital health can enable a lot of that work.
And you talked several times about culture. In Canada, we don't really have a culture of innovation and risk-taking. Is that changing? Can AI accelerate that?
I do think it is, and it's interesting. I think it's changing because patients are demanding it, and because citizens are demanding it. People, come when I see them in the Emerge or I see them in the office, they always say, well, why can't I? Why can't I communicate with you electronically? Why can't I book my appointment online?
What's a fax machine?
What's a fax machine, right? And so I think that, we are being pushed in large part because this has evolved in many other industries. And healthcare has been we're one of the few industries that still uses a pager. So we're evolving, but I think we're being pulled by our citizens.
Right. Now, Eric, I wanted to turn to you. You're in a kind of a different position from others on the panel. You're in the insurance sector. You're seeing both the challenges, the opportunities of how private coverage intersects with public healthcare coverage. What trends in group benefits and employer-sponsored healthcare are reshaping the way we access care?
Yeah, great question. I think, and you're right when you say it's a teamwork, it's a global work. I think as a group insurer, our client, the primary client, are the employer, the plan sponsors. So in fact, the patient, our employee in a group, the group hire us to manage the group plan. So I think we're all in the same global health ecosystem. And I think quick intervention is always a key. If you look at group insurance, to manage health of a plan members, but also to act quickly so that it will not turn out into a disability episode. So employer, when they hire a group carrier, I would say main thing is to keep their employees healthy at work and productive. So that's the job we're trying to do. And I think the access has been probably a problem in the last few years because it was difficult to act quickly because of access problem, and we had a lot of pressure as group insurer to find ways to help a little bit on the access side. And we did it with partnership with TELUS, for example, for employee assistance program. I think that's a space where we offer employee assistance program through the group plans with partnership, and that allows an access that would not otherwise be available. So you say you have a mental health crisis, you can phone a line or have a first contact and then have treatment thereafter with a psychologist. So it's a good thing for access and prevention, so that you will not have an employee ultimately that will be on disability. Also with telemedicine, so that's another way, and it has been really helpful throughout COVID. So that's, I think, the part that we can do in the space as group insurance carriers. Another trend, I think, is how can we work better with the actors in the health ecosystem? An example that I will give on that is that a few years ago, Beneva were the first group insurance carrier in Canada to remove the need for a referral from a family doctor to see, let's say, a chiropractor or a physiotherapist, and the market followed through. And I think that was a part, I think, that we can do as an actor to remove pressure on the time, your precious time of family doctors. So I think that's one example. Another example, we are working with all the other carriers in Canada to try to standardize the disability insurance forms. So I think that's another place where family doctors say it takes a lot of time to fill those forms. So if we can get one formulary or a few formulary, not the full collection that we have right now, that will help ease the access and free time in the public sector. So that, I would say that's a trend that we see, and the next step would be to connect that electronically. So let's say you don't even just have a standard form, but it can be filled directly from the doctor's medical record and sent electronically to the group insurance carrier. So that would eliminate a lot of back and forth that sometimes would make a situation degenerate into disability. The other trend I think I see is innovation, like all the new drugs. We have a role to play when a drug is approved by Health Canada. We put it on the formulary, so that allows coverage to the plan members. So I think with anti-obesity drug, it has been a good example the last few years. And also all the precision drugs for oncology, that also been a game changer for our plan members and plan sponsors. So I think that's the trend I see in that field.
And it's interesting to me, the private insurers seem to be doing more on prevention, more on streamlining than the public system. And I guess it's because you pay a lot more attention to the bottom line.
Yeah, maybe. But I think everybody's doing more these days, I would say. I've been in the market for 32 years right now, and I saw a lot of change, as you said, recently. More change in the last 5 years than in the 25 years before. So I think that's a good trend.
Great. Now, we've had this robust discussion about the challenges facing the healthcare system. Let's now turn our attention more to solutions and innovations that could help resolve some of these problems. I want to turn back to you, Dr. Brophy, if I could. Can you give us some example of specific innovations or approaches that you've successfully used to bridge the gap between technology's promise and the clinical reality you deal with day to day?
Absolutely. It's a great question, and that kind of bridging is just so key. So I'll speak to a very personal example in terms of just the overwhelming burden of administration, patients, COVID, and all that kind of stuff. And it really was starting to take a lot of the joy out of medicine, and I was really starting to burn out. One of the pieces to that really helped me recapture kind of the love of what I do was introducing an AI scribe. So a technology where it listens to the conversation I'm having with the patient, so my 100% full attention is directed right at the person, as opposed to typing, what did you say? Typing to get that good, robust documentation that's required. So I'm able to connect with the person in more meaningful ways. I'm paying attention. I'm noticing little clues in their body language I might not have picked up. And I had the space cognitively to oh, how are the kids? How's this? So it's really been a game changer in that sense. It's helped me reduce my paperwork. I'm not, writing my notes at night anymore. So it's been really helpful. It's tough though to try to expand and scale that up right now. I'm definitely on the, more it's shiny and new and I want to try it kind of scale compared to a lot of my colleagues. But there's so much complexity to adopting something like this. What's the medical legal rules around privacy information when it's going in and out of a scribe? And to Hashem's point, like if it's leaving our borders, well, what's the risk there and how can I make sure that I'm doing that in an appropriate way while still getting a solution that's going to help me improve care? And that's a big barrier to people adopting these kinds of tools. What's going to happen with that data? Where is it going to go? Who's going to own it? And what's that going to mean in the long term? One thing, and maybe you guys can tell me if I'm being a bit too anxious or paranoid about this, that I worry about is if we don't get ahead of these kinds of trends with good data governance and really good legislation, I worry that there's going to, unfortunately, eventually be a bad outcome that's going to be tied back to one of these AI solutions. And I would hate for litigation and someone being sued to derail all the progress and the promise that we have moving forward. So I think we need to be really mindful and push for that for the future.
I have to say, as a patient, I've used the AI scribe, and it's amazing. Your doctor looks you in the eye, right? It's a new world. It's like the old days.
Yeah, it's brought so much joy back into my day-to-day practice, and I think everyone feels that, the patients as well, too.
Yeah, great. Now, Dr. Bhatia, we're seeing this shift in the expanding roles of healthcare professionals. Pharmacists, allied health providers are doing more. We have more integrated teamwork. How can we better leverage getting everyone to work to their full scope of practice to improve access?
Yeah, it's a great question, and I think about the original question that you had posed to the audience around how many doctors we'll need, and the reality is we're not going to have that many doctors, right? So there just aren't going to be enough, and so we have to find ways to be able to service the population that we have with their growing needs, with the recognition that not everybody is going to be able to access that physicians in that way, in the way that we have in the past. So that's going to require all members of the healthcare team to operate to full scope. In many ways, it's that age-old article from Atul Gawande, which was about, more race car teams, less cowboys. The idea that, historically, family doctors worked in practices by themselves and were really fragmented or pushed away from, the hospital and the pharmacy were all separate. And now we're really working to a time when we're actually going to see teams of people, the race car team, where your pharmacist and your family doctor and your hospital and community-based specialists, your physiotherapists are all going to be working in concert. So the question is, there's a couple ways to do that. One is to physically co-locate them. So in Ontario, we are, I think, launching a generational investment led by Dr. Jane Philpott to increase the number of primary care teams. So right now in Ontario, 30% of Ontarians have access to team-based care. And by 2029, it will be the majority of Ontarians will have access to team-based care. So that's physical co-location. But the reality is that we also are not just going to use physical co-location because specialists won't always be on site. Your community pharmacist is a critical part of the team. Your physiotherapist may be off site. And so how do we use digital technology to enable that? So some of this is about the technology, creating real-time communication, being able to have notes that are shared, being able to have a best practice medication record, for example, so that everyone can see what drug somebody's been prescribed. But it's also, the technology is the small part of it. The bigger part of it is how do we break down privacy? How do we break down some of these policy moats that we have and frankly allow data to be opened up so that, again, we're wrapping care around the patient. So that's going to be part technology, but a significant part of that is also going to be the policy work that we have to do. And again, this cultural shift that encourages each of our health service providers to be working together as a team.
Now, Hisham, you have an expertise in the technology side. There's kind of this race between AI learning human behaviors and humans learning to use AI. So how are we doing on that learning curve on both sides?
It's a great question. But I actually don't like looking at it that view, right? Because when you say it's a race and someone's got to win, then it's a zero-sum game. And it means there's a winner and a loser. And I actually don't think it is. I mean, I personally, and at TELUS holistically, We believe in human-centric AI. And we actually believe that this will create a virtuous cycle. And so I don't think there's any winner or loser. I think what's going to happen is AI is quickly becoming able to do a lot of the tasks that humans do that are not really value add. Like you were giving Dr. Brody, like, you know, typing, filling in notes. And so how does that free up the time that we can actually do the value add tasks? And so then we start learning how to use the AI tools to do that, then that frees us up, and then the AI starts learning to do the other tools, we start getting better at it, and it's a virtuous cycle that happens. And so I think we're not in a winner or loser game, but I think we're in this continuous virtuous cycle, and the more that we lean into it, the more that we start adopting it, I think the more that like all boats will rise, and we will see huge gains in productivity. I mean, you know, we all know that Canada's lagging, we have a productivity crisis, but also in terms of prosperity. I mean, there's probably $230 billion on the table, last estimates, right, if we kind of adopted AI. But I also think in great outcomes and what it can do. So don't know if that answered your question right, but I actually think it's a virtuous cycle. And maybe one thing I just wanted to say is, because you made a comment earlier that Canada seems to lag in innovation, and I think maybe in some sectors, but let's not forget, AI was invented in Canada. And modern AI was built in Canada and created in Canada. Dr. Jeffrey Hinton has created the neural networks, and that's the base of all modern AI. That was done here in Canada. It was Canadians created. You look at all modern telecommunication, most of that was all invented in Canada. So I believe Canadians, it's in our culture and our DNA that we are very innovative, very creative. Let's just lean in it and amplify it.
But that's the part we have to do, right? We invented the telephone too, and we didn't cash in on it. Same with the AI to a certain extent.
But here's a great opportunity. We are such an inflection point, and it's a new opportunity to really seize this and really make a difference.
So let's talk about opportunity the next 3 to 5 years, where we're going. Maybe Hisham, I'll stay with you. What's coming down the pipeline? What's the exciting stuff coming in AI and health technology?
So I think I'd like to talk about two things there, right? And so the first one, especially when it comes to healthcare, the most important part of the word healthcare is care. And when we think about it, when we are coming to seek healthcare, it's because we are most vulnerable and we're most needed, and so we actually need that care. And I think for all the reasons Dr. Brody was saying, it's hard to do that. Our practitioners are stressed. They're stretched for time. They have so much cognitive burden and load, and so as much as they want to offer that care, it's very hard to do. So how do we bring the humanity back into care? And I think this is where it is. All these AI tools can bring that, can free up the time and create and allow that integrated care and that team-based care, but do it in a very connected way. And so that's what I'm very excited about, is where does the care really come back in the human element of it? I think we have to answer all the issues you talked about of like where the data goes. And I don't think we need to wait for regulation, because if we do, it will take too long. So where do you lead by example? And I think this is where TELUS, again, back to us and our responsible AI, we're trying to lead by example. Let's assume that. So let's not wait for the epic failure that happens, but let's build it and guarantee it. And so any practitioners like yourselves can guarantee, if you're using a TELUS system, then you know that it's all going to stay and have the right governance, right structure, right sovereignty. Like, we'll do that in built by design. That's one area I'm really, really excited about. And while it doesn't seem transformational, it truly is, because those small differences make a huge difference in outcome. The other part would be, I think, what Eric was talking about, just the research that's being done now in genetics and in precision medicine. I think you saw, like, this year, the Nobel Peace Prize went into protein folding. That was an intractable problem that wasn't going to be solved. Now that you can do that, I think within the next 5 years or so, you're going to see some really great medical breakthroughs. And some of these diseases that we thought were unsolvable or incurable will actually be tractable problems now. And that's, when we think of humanity, what that can do for longevity, I'm very excited about that.
Great. And Eric, same question for the insurance industry. Where is it going, say, by 2030? How is this, there going to be a shift between employers and insurers and workers? How are they going to shift what they expect from their insurance?
Yeah, I think there's, first of all, I think about the connectivity. I think we all talk about information and the importance of the information flow. So for sure, that's, I think, a space where the group insurer can be better at. So how can we connect to all that information instead of just redoing the work? So, and it has been difficult in the past, mainly because I think group insurer, we rely on old ancillary systems that was done probably in the end of the 1980s. So we patched that, but it's still difficult, let's say, on the connectivity standpoint. So at Beneva, one project that we are deploying right now is a new back office technology ecosystem that will for sure facilitate data integration and enable better connectivity for our plan members' health conditions. So for us, I think group insurer role will move a little bit from being just a claim payer to a little bit of a coordinator of our plan members. So maybe we can use the data we have to better coordinate where they can go to find the service in the system. So I think that's a role that we can take in the following years. Also, I talk a little bit about disability, but we can maybe take some space to develop some tools with the help of partners like TELUS. Like we are doing a research, we founded a chair in Quebec with Laval University. It's called the Relief Chair for Auto Management of, notably auto management of mental health. One part of that is how can we develop tools to auto-manage or self-manage anxiety? So I think that's some space where the health partners, the group insurer, we can help bridge, I would say, the gaps that we have in the public sector system to help ultimately plan members to stay healthy and at work. And that's where the employer will get ROI for their group plans.
And you raised two really important points. People don't always know where to look for information, and they want to take more control of their health. So an insurer is going to have a more important role in that.
Yeah.
Great. Now, Sasha, you work a lot in changing the system writ large. Where do you see it being in 2030? How's it going to be different and hopefully better?
Yes, I hope so. So I think a couple big things. I mentioned in Ontario, I think we are going through a generational opportunity. People know that there was an election in Ontario. There was a commitment to spend $1.8 billion to basically get everybody family doctors. The underpinning of that, led by Dr. Jane Philpott, is really the creation of over 300 new primary care teams. And so why that makes so much difference is we're really changing the primary care model, which was one where you had sort of doctors working in a silo, to a more multidisciplinary team that will also be accountable to the public for standards around access, around attachment, around access to their data. So, you're gonna now start to see a much more modernized primary care system, akin to what we've done in the hospital sector, where you've seen a modernization of the hospital sector. And so now you will actually be able to begin to then layer in things like digitization, digital tools. Let's finally axe the facts and get rid of paper, because you can't do any of the AI things that Hashem has talked about without actually getting rid of paper-based forms, paper-based referrals, paper-based notes. So we're going to do a lot of that. And now when you have a modernized primary care system that's underpinned by data, and you have a modernized, hospital-based system, you can start to really begin to engage in chronic disease management and prevention across the life cycle. And that, I think, is the future of where we want to go. And in particular, then using and enabling digital tools, both to communicate, both to analyze the data that we have so we can do predictive modeling of disease progression, and actually think about ways that we can now begin to change the trajectory of somebody's disease. And we're starting to see it in small ways in hospitals, where we have early monitoring systems or early warning systems, where somebody who gets really sick, we can actually interject or intercede using AI to say this person is actually going to need earlier intervention. Imagine being able to do that in primary care. Imagine being able to do that with chronic disease management in someone with diabetes or someone with COPD or heart failure. So it is, the next couple years is really about building the infrastructure to make a lot of the exciting things that Dr. Brophy and others have talked about happen.
And Dr. Brophy, we have this new generation of healthcare providers coming up, essentially raised in the digital age. How are we going to make sure that they have the proper skills to use these tools to their full scope and still be able to do the human stuff that the old timers do?
Yeah, absolutely. I think it's an interesting question in terms of how we're training and how we're evolving our system. Because coming back to the points we were just talking about here, that humanistic and that compassionate piece is really the most important thing. And we need to make sure that our systems and our tools are not coming in the way of that. And that's really what gives us the most joy out of what we do. And that actually really, truly leads to the best outcomes as well, too. So there was a study where they were looking at kind of chronic disease management in particular, and that connection with a longitudinal relationship with a family physician and what that actually means in terms of outcomes. So if you took all of your people with heart disease, for example, and you gave everyone a cholesterol medicine, you'd reduce sort of their risk by about 28%. You give them all a long-term relationship with a family physician, and you're going to reduce that risk by 48%. So really, really meaningful stuff here. So I think we have to be careful that we're not losing out on those humanistic and those compassion skills. And we need to, like I said, design our tools so that they work with our workflows and they work with how we operate, and they don't create a barrier to entry. Because if we're designing our healthcare system to work in a way where you have to have really high tech knowledge and skills, we're going to lose some of the best, most compassionate people in the profession, and the whole system, and especially the patients, are going to lose out on that. You're going to lose out on opportunities like, hey, this is your 4th visit for your stomach pain, and the workup's been normal, and all your blood tests are normal, and you're still not getting better. I know you, I know your family. Maybe you're upset that a family member's been diagnosed with an illness. Let's deal with that, and let's get to that place of wellness and support from an avenue you don't get without that human and that compassion component, which comes from a long-term continuous relationship. With the expanded scopes of care and access to virtual care, we're really increasing our convenience, which is necessary right now, but I think we have to be really cautious that convenience doesn't come before that idea of continuity. So those expanded scopes are going to feed, and they're going to work within a whole team who knows you. And I'm going to get appropriate information back as a family physician to help really manage and understand what's going on as a whole system with all their interactions with my team members. So I'm going to have to be a little bit more of a quarterback than I already am. So that's another skill we're going to have to really be evolving with. But we really risk eroding that continuity and those really important relationship aspects if we focus too much on convenience. So we have to be mindful of balancing these things together and how we're designing our systems and how we're putting things together. But it's a really, really interesting opportunity right now where it is so transformational right now, and we have a huge opportunity with all the attention on primary care to get it right. And we're at such a breaking point where I worry if we don't get it right now, especially with all the local transformation in Ontario, that it's really going to be a big detriment to family medicine and the healthcare system as a whole.
And you mentioned before, you're an early adopter. You're looking at this stuff. How do you make sure everybody gets on board so that a patient doesn't have one doctor who's digital and the other one who's still paper-based?
Yeah, it's something I struggle with, absolutely, trying to help my colleagues and peers sort of take advantage of the same successes or the same gains that I've had. And that comes back to the point I had made earlier, where it's a little bit about that support to give us the space to actually decide, well, what tool is going to be the most helpful for me in my situation, and then how can I implement that in a meaningful and appropriate way? And we don't all have that tech knowledge and desire and drive that I may have, where I'm sure if you talk to my colleagues at my clinic, they're going to say, Kevin, just chill out. Let's not chase the next new shiny thing until we get a little more settled on this. And everyone has that different comfort with that new and that different tool and how it impacts our workflows, for better or for worse. There is a real burden of innovation, which we don't recognize, where it takes a lot of time, a lot of load, and similar to what Eric was describing about kind of changing things in the insurance industry, you get so used to doing something in a certain way, where if you don't have the support, you don't have the incentives, and you don't have the right tools to make that transition, you just keep doing the same thing again and again, even if you could be doing something better. So it's a big challenge for sure.
Yeah. Now, Hashem, earlier you corrected me, and I appreciate that. You said, hold on, you're repeating stereotypes. And so that made me wonder, like, what are the other misconceptions that you're faced with when you talk to other executives, when you talk to people about AI? What are we afraid of that we shouldn't be, perhaps as Kevin said?
Maybe as Dr. Brophy said, though, is I think a lot of people are looking at AI as the silver magic bullet that's going to solve everything. You're like, replace the process, with AI and it's good to go. And I think that's a bit of a fallacy because AI only goes so far. I mean, it's a tool. And so you got to make sure that we're not over-rotating on convenience, like you said. We're not taking out the compassion. We're also not, I always talk about in my own internal teams, you're using AI to automate stuff, but you're institutionalizing bad processes. So before you try to automate it, let's go first do the process re-engineering, because then once it's automated in AI, then that becomes the de facto. And so I think that's a big thing that I'm having to talk to a lot of people and explain about AI, that it's not just go and adopt the AI and it's going to magically fix. And there's a lot around it that has to happen in the change management. The other thing I'll say is, and this might be a bit controversial, right? But there's a lot of distrust around AI, and then they say, like, we can't trust the AI, and that's why we always have to have a human to do it. And it's not that I'm against the human in the loop. You need to have a human in the loop, but the human in the loop is not a corrective. Because actually, if you follow the data and look at the science, the mistakes that AI makes are way less than what humans make. And that's because humans are stressed, humans can get tired and fatigue, humans can be influenced by factors, fear of losing their job. And so there's all these factors that make them make errors and mistakes that AI doesn't have. And in fact, all the errors in AI are detectable and correctable because it's just a matter of tweaking the data or tuning the model, and so you can correct it. And so this fallacy of, hey, you can never trust AI and you have to have a human is the wrong way to look at it. You need to have a human in there, but the human is to augment the AI. And so how do you elevate now the practice? Because the AI can never get you to that level of compassion, that level of humanity to it.
Not
and
yet.
That's the right way to put the humans
Not yet, right?
Yeah, not yet. Well, yeah, but still, like there will still be that element. Maybe in a world of multimodal and video and augmented reality, but I think that's the thing. Like a lot of people are saying, hey, the role of humans is to act as a supervisory on AI and corrective, and I think that's not it. It's actually, there's other ways to supervise AI, make it better and trust it. You should trust it, and instead use the human in the loop to augment the whole experience.
And Sasha, I want to come back again to something that Kevin said about the importance of continuity. Mm-hmm. How do we ensure continuity in this really fragmented system? And again, can the technology help with that?
Yeah, I think so. I mean, a lot of times people talk about technology from necessarily fragmenting, by design. And I think we saw that in COVID a little bit when we went to virtual, platforms to be able to provide, in particular, primary-based care, like through walk-in clinic type models. I don't actually see technology either as fragmenting or unifying. It's a tool, and it ultimately augments your workflows, or it follows the policy or follows the funding, right? So first and foremost, what we have to do in Ontario is ensure that every person has an access to good team-based primary care. To me, that's the beginning. That's the beginning of the conversation. We go to other things when that initial premise breaks down. So why do people use online platforms? A lot of the times they use it because they can't get access. Either they don't have a family doctor or they don't have access to a family doctor, weekends, nights, or whatnot. So I think that the first thing is we have to provide the basis for team-based primary care, and we have to have specific accountabilities for that team to be able to provide access. And then in that, I think Dr. Brophy talks about this. Like I think about this like a bank. When you go to a bank, there are many different ways that I can access banking services, right? I don't always have to go to the branch. I can access it through my phone. I can access it through, the web. I can access it through, I can deposit checks online. Like there's lots of different ways to do it. And I think we should be offering up a multi-channel universe in healthcare to be able to access process, people's needs. And that doesn't always mean it has to go to the family doctor. You can send a message, through, your app potentially to a nurse, and the nurse can answer a lot of the questions. A lot of the questions I get through my clinic are predominantly administrative that don't actually have anything to do with me. So I think that we need to be first installing and setting the funding and policy levers that ensure that we have high quality team-based care, and then we should be augmenting that with channels, and eventually we will get to the point where AI will be able to do a lot of the things that, for regular queries, right? AI chatbots, when somebody calls, and actually we run the Health 811 platform in Ontario, and we do have chatbots and symptom checkers that use AI when you're like, I have a child that has a fever, or I have, I have a stomach ache. It will give you your symptoms, and it will give you probabilities about what this should be and what I should do next. And it's actually incredibly accurate. So the point is, once you set the policy and funding foundations, now the digital tools can help augment, the experience and bring teams together rather than fragmenting them.
Interesting. Now, we have a few minutes left. I want to, you guys are really passionate about talking about the future, so I think we might as well stay there. It's a good place to go. I want to know, though, what excites you the most in the next few years of healthcare transformation? Not vague predictions, but some really specific opportunities or initiatives that you're seeing and that you're excited about. Maybe, Eric, what's going on in your industry that you're really excited about?
Yeah. First of all, I think that what makes me, I would say, the most optimistic about future is the fact that I think we are less siloed than before. So just the fact that public health, doctors, insurance carriers, like TELUS, health partners, we talk more than before. So I think that's a good sign. And also all the tools that we have now. So when people designed that system many years ago, they can't even dream of the tools that we have now at our disposal. So we have the opportunity to really raise the bar in our system to cope with the increased demand caused by the population aging. So I think that's a fantastic opportunity. And also you were talking about the tools, like the group insurance carrier. I think we have a role by explaining also to the plan sponsors, the employer, how their employees are using the tools. One example I would give is the blood glucose monitoring systems, continuous system. My wife is a diabetic, type 1, since she's age 13. So I saw the shift when she began to manage her diabetes with those tools, and it's a huge difference. So now she take a lot of accountability in managing her disease, and she extract the report and then see the doctor, they look at it together, and then, so I think it's the same if we can do it with mental health, and all the tools will be available. I think a big part of what we can do in the future is to maybe put more accountability on the patient to self-manage a lot of things, and that would reduce pressure on the first line.
And patients want to do that, but only if they have the tools and the ability. Like diabetics, a very good example. Their world has changed dramatically, and they do a lot.
Yeah, for sure.
Great. Now, Hashem, same question. What really energizes you about the future?
Well, I think it was the two things I said before, right? It's that bringing compassion back into the care. Like, I think that's really a possibility, using all these tools and having that. And then also the innovations that are going to happen. Like, I'm really excited. I've been reading a lot of papers around the protein folding. And this is truly transformational. It's stuff that we could not have done, and it would have taken hundreds of years to do the computation on it. So I'm really interested to see what that comes. What Eric just brought me, maybe I'll add a third one, is maybe a lot related to AI, but it's more to the data and connectivity. Now there'll be less and less chances where people misdiagnosis or have missed opportunity for the care because a data point was missed, or we didn't have it and got hidden. Like, I think now there's going to be a continuum of data that's shared across all the practitioners, and some of it's going to be from the practitioners themselves collecting the data, but some of it's going to be from wearables and devices and continuous glucose monitors. I think that overall data view of the patient will really make it comprehensive, that we don't have any more of these like missed opportunities where something was missed and fell through the cracks.
And we often say things like data is the new gold, the new oil,
right.
But are we using it? I get the impression we've got all this data and we're using a tiny fraction.
Yeah, and I think so. But back to like if we lower the barrier to entry of how to use it, both from patients, but then as practitioners, I think you'll start getting the adoption. I think the problem right now is it's that barrier is too high, right?
And Kevin, you're already energized, but going forward, what excites you, maybe particularly for your patients? How's their life going to change with some change that you picked that's coming that's really going to impact them?
Yeah, I mean, there's so much opportunity here, and it's such a transformative time. I'd say like real, like boots on the ground kind of example is the opportunity for using AI to empower patients to really understand what's going on in their health. So a common example would be some of these portals patients use. There's times where a patient will log in and see a scan result that has all these big scary words in it. And they panic and they're stressed and they're worried and they come see me. And I look at that and I know what those words mean and I can just say, it's fine. It's okay. It's just a big word we use because we like using lots of jargon. Now there's this opportunity where I can take that information and even if I can't find the right words, I can use AI to help me find the right words to connect with my patient. I'm in an area where there's a lot of non-English as your first language patients, so I'm able to use that to also translate that information into different languages to make sure they truly understand what's going on. So they're empowered to manage their own condition like diabetes, understand what the meaning of the reports really are, and take hold of their opportunity to kind of manage their own healthcare and be autonomous, which is so important for people. And that's so much of the uncertainty and the stress we come is people feeling out of control, especially when it comes to your own health. So the more we can do that, the better. Even just using like small little summaries of, hey, this is what we talked about today. These are your next steps. These are my next steps. And this is what I'm going to see next. And being able to generate that in a few moments and then send that to them for them to review at any time is phenomenal. Another really concrete example that I'm really excited about is there's this new collaboration between some organizations in Ontario. So the Ministry, Ontario Health, Ontario MD, where they've gotten together with these AI scribe vendors to create sort of a process where they're vetted, all the medical legal complexity around information has already been dealt with by experts. So I know if I choose from this list, it's going to be a solution that is backed and I'm protected and I can scale it and evolve it. So I'm really excited for that to come. And I think that's going to be incredible for kind of curating the incredible amount of options of tools that are out there. Sometimes it's paralysis by analysis where you've got so many tools you could use, but you just don't know which ones to choose and why, and it's so complicated. So if we can continue this momentum of really trying to curate all these options and all these tools in meaningful ways, and then give the change management support to the family docs and the community providers and other physicians, then we're really going to make a big impact. So I'm really excited about that.
Great. And Sasha, when we talk about healthcare, you're on the government side, it's often very negative. You know, the aging population, no doctors, it goes on and on. But you've been very positive today. How do you keep that energy and what makes you confident things are going to change dramatically?
Wow, yeah, this is a fun conversation to have. I would say, so two things. One is I'm confident because I'm actually confident in our citizens. I actually think the change that's going to come in the next few years, and you see it, is because we have a very engaged citizenry in Canada that is interested in their health and is interested in us doing things differently. And honestly, we are not going to change by relying on the system itself, meaning doctors and hospitals and nurses. I mean, we're great, but to be honest, change doesn't come there. There's a lot of inertia, in traditional stakeholders, but citizens are asking and demanding that we do things differently. So I'd say that's probably the biggest hope that I have. And the second, frankly, is I don't think we have a choice. Like, we've been talking for a decade about the baby boom, and the baby boom is coming. No, the baby boom is here. And, the economic pressure that the baby boom is going to cause for policymakers, the impact it's going to have on hospitals, on our HHR needs, et cetera, is going to be so substantive that it's like pressuring a piece of coal to create a diamond. Like, the pressure itself is going to force us to innovate and force us to change. Otherwise, like, we're never going to get our emergency rooms clear, and we're never going to attach all the people that we need to physicians and to primary care. And so I just think the status quo isn't enough. And as everyone has said, I've seen probably more change in the last 5 years than I've even seen, in the previous 10 to 15 years. So I feel like this pace of change is accelerating, and not just on the medical field, but in the health system world. So I'm actually quite excited about what that's going to show.
And it's interesting, I think a common theme throughout all our discussion has been this empowerment and positivity, and it's refreshing to have some positivity when talking about healthcare. So I want to thank you all. It's a great conversation. I could have it for another hour, but I'm not going to indulge you or allow you to get that, because we have another panel coming up. So thank you again for this exceptional, this rich and insightful discussion. We've moved from examining our current challenges to exploring emerging solutions and opportunities for meaningful change. What stands out, I think, is that the transformation of healthcare requires alignment across a whole number of dimensions: technology, insurance, innovation, clinical practice, system design, culture, the attitudes of patients. So thank you, Hisham, Eric, Kevin, and Sasha, for sharing your expertise and your vision with us today. And now let's go back to Colleen to see what's next on the 21st Annual TELUS Health Conference agenda.